here is another episode in my series on things that I say to, or talk to patients about a lot. Dr. Joel's knowledge bombs or nuggets, whatever you want to call it. So this one is don't be afraid of your back, or that's the line I have up here on the board. So this is a common one where the low back or the whole back area, and I mean, maybe rightly so, right? I mean, it is where your spinal cord is, right? Like, that's important. But this is an area where when people come in with low back pain, it is like, dude, my life is over. You don't get it, right? Like, this is the one, my great aunt, she died of low back pain, and this is the one I'm gonna have to get surgery. It's like they do what we call catastrophize more than any other type of area of the body. People catastrophize over their back, okay? And I mean, one reason why is because low back pain is pretty common, and then it is poorly managed for a lot of people, and so most people know someone who has what you would call debilitating back pain that seems to really cause them a lot of problems. So, but what I want to talk to you about today is not to be afraid of your back. I don't know if it's maybe because it is behind us that we can't see it, right? Where it's like, oh, okay, my knee hurts, but I can see that. It doesn't look too messed up, right? So, if that's another reason. But you don't want to be afraid of your back. It's really not that much different than any other part of your body. It still has the ability to heal, just like any other part of your body. It's made up of different joints. There's a lot of nourishment. There's a lot of blood supply and all these things that help your back to be really healthy. And so when we get people in who have low back pain, a lot of times we're really encouraging them to move early and often with their low back pain, because the movement, hence mission move, right? The movement really helps them to feel better, because as you move, that helps to provide some more nutrients and blood supply to the back, and that will help you feel better. Kind of an overarching theme we have with people with low back pain is a healthy back is a strong back. So this goes back to my video I did where people are told not to squat and deadlift. So when it comes to low back pain, we're always going to be teaching you at some point when you're feeling better how to squat and deadlift, because those are normal movement patterns. You do those patterns all the time. When you go to pick up a case of water or laundry or your luggage or things like that, or just a sock off the ground. So people who have quote unquote bad backs, we tend to find that they have weak backs because they've been trying to avoid their back because they're too scared of their back. Because once you have back pain, you never want to have it again, so you're really, really scared and fearful of your low back. So it's like, well, my back is out to get me, so I'm just going to go through life and try not to piss my back off so that I don't have another episode of low back pain. And that's the opposite thing that you want to do. You actually want to engage your back muscles and your core, and learn these movement postures and really have a strong back. And that's the key to having a healthy back for a long time. So don't be afraid of your back, okay? If you are afraid of your back, if you've had some bad episodes of low back pain, or you seem to have ongoing back pain, and you've been to some doctors and can't really find anything really big there wrong, other than just like, some disc type things, which research shows that a lot of people do, then give us a call. We'd love to help you with that. We'd love to show you how you can be more confident in your back and have a really strong back so that you can do everything that you love to do and live a life not afraid of your back.